In this section, we'll concentrate on proper procedures for filling prescriptions. Filling prescriptions involves much more than just counting pills. In veterinary medicine, unlike human medicine, the vast majority of prescriptions are filled in the veterinary hospital, as opposed to being filled at the pharmacy. The veterinarian and the staff must assume the responsibility of accurately filling the prescription, just as a licensed pharmacist would. Mistakes in the pharmacy could create legal and medical nightmares for you and the doctor. In most veterinary hospitals, the veterinarian relies on his staff to fill most prescriptions. The doctor will always choose the medications and will often be the individual to discuss side effects and other important drug considerations with the pet owner. The technician or assistant must be able to read the appropriate prescription symbols and abbreviations, be familiar with the pharmacy inventory so as to locate the indicated drug, and accurately dispense the product to the owner, being sure they know exactly how the medication is to be given. Labeling prescriptions may require you to familiarize yourself with a computer program that prints the labels. In other hospitals, the labels may be handwritten on self-adhering pre-printed labels. You may be called on to go over the administration directions as well as tips for getting the pet to take the medication. Helpful administration pointers are often very much appreciated by pet owners. This is especially helpful with cat owners. You might show them how to wrap up their cat in a towel or other techniques that will simplify this task and minimize their personal injuries. Let's review the prescription process from the beginning. The doctor will either verbally or in writing communicate patient information, the medication, dosage, frequency of administration, and duration with each prescribed drug. You cannot fill a prescription without all of this information. By law, a prescription label must accompany every prescription dispensed from your hospital. There are likely both prescription items and OTC or over-the-counter medications dispensed from your hospital. Over-the-counter medications are those that have therapeutic value but are not dangerous enough to limit the usage just to doctor's orders. OTC drugs do not require a doctor's prescription and include drugs like Pepto-Bismol or Neosporin ointment that are readily available at a grocery store or at a local pharmacy. You will very likely be dealing with both prescription and over-the-counter drugs. If you're not sure as to whether a product is a prescription item or an over-the-counter product, ask the doctor. It's always safe to err on the side of labeling things you're not sure about versus dispensing a prescription product without proper labeling. It is important to know that certain dog and cat foods, those used for specific medical purposes, may fall into a prescription classification. The following information should be included on every prescription label. Some of these items will probably be pre-printed on the label and do not need to be rewritten. 1. The name and address of both the prescribing veterinarian and the owner. The animal's name can be put in quotation marks followed by the owner's last name. For example, Snuffy Adams would be appropriate. Number 2, a description of the patient. This could be as simple as the species, canine or feline, and the gender of the animal, male or female. Number 3, the date that the prescription is filled. Number 4, the name, strength, and quantity of the product being dispensed. Number 5, the drug's expiration date, which is usually printed somewhere on the original label or bottle. Number 6, precautionary statements. This might include notifying the owner to shake, refrigerate, or give a medication with food. Some hospitals have stick-on labels for just such details that can be added to the prescription vial to save space and make it more noticeable. Number 7, and finally, a description of how the drugs are to be given. This is often called the SIG. It is at this point that doctors will often use a series of Latin abbreviations that are universally used to convey specific instructions to pharmacists or others filling a prescription. There are many pharmacy abbreviations that exist. You will be exposed to the most commonly used in veterinary hospitals. Some practical memory aids will be included to help you remember abbreviations. Your job in filling the prescription is to accurately translate the doctor's prescription into common, everyday language that any pet owner would understand. Let's examine some of these abbreviations. BID means twice a day or every 12 hours. The prefix bi means two, as in bicycle, having 2 wheels. TID means 3 times a day or every 8 hours. The prefix tri means 3, as in a tricycle, having 3 wheels. Q is the common abbreviation meaning every. A SIG that says Q6 hours, or Q6H, means every 6 hours. QOD means every other day. QD and SID both mean one time every day or once daily. QID means 4 times a day. Because these letters can appear so similar to QD, it is very important to be certain as to what the doctor has written. PRN means administer as needed. This might appear in the SIG after the dosage and before the symptom. For example, PRN itching would translate as needed for itching. Other commonly used abbreviations are used when referring to the instruction for the use of ophthalmic or eye medications. OD refers to the right eye. If a prescription for eye drops contains the abbreviation OD, it is limiting its use to the patient's right eye. OL or OS both refer to the pet's left eye. OU refers to both eyes. Your veterinarian may have other abbreviations he or she uses that you may need to familiarize yourself with. Your workbook contains several examples of translating prescriptions for you to practice on. Understanding exactly what the prescription says is the vital first step to you being able to read, fill, and label the prescription. If a prescription ever seems inappropriate to you, always double-check with the doctor. When in doubt, ask. Once you've read and understood the prescription, you are now ready to begin filling it.